get as close to the posterior teeth without them actually touching. And rather than just trying to make the anterior deprogrammer and then spend a lot of time grinding it back down to minimize the inner molar distance, we'll go ahead and we'll cheat and we'll use reduction clearance tab. The pink ones are 1 millimeter thick. So what we can do is when we look at our patient, Michael, just relax. So you know what, I don't have enough light. Close for me. Relax. Good. So we can actually, at the closest molar location, open again, please. And just gently close. And we'll put it at the point of the second molar. And he's not going to actually clench on it, but we're going to bring him close. So that'll actually give us the kind of separation we're looking for. Now, we're going to use something easy, like a light curable composite. And I don't know where you hide your lights, thank you. And open for me. It'll be adapted over the centrals. And what I'll actually do is for the first guiding, I will place the little reduction tab. Let me just gently close and hold right there. Perfect. And we'll go ahead and cure that. So for me, please. Making sure it doesn't lock on. That's always a bad thing. Side. Okay, thank you. And what we're going to do is place it back in.
What are you using right now for your program?
It's just what, Rivatech?
Is it Rivatech? Exactly.
Yeah, just Rivatech. Now, what I'm going to do is we'll just use any color articulating paper and relax. Bite, tap, tap, open, open, bite, open, and close. Turn towards me a little bit. What I'm doing is looking for the closeness of the closest posterior tooth, and there's no posterior tooth touching. Do you feel any posterior tooth touching? Okay, open. So he's at least a millimeter, probably a little bit less, separated to the closest posterior tooth because it does have a little compression. So what I'm going to do is we're going to start cleaning up this because you can see I really only need one spot, but I also want to make sure that he's only touching on this flat plane, that there'll be absolutely no deflection on the ramp portion that we just did. Okay. Then go back. Try this in. And open. Relax. Close. Good. Open. And close. Tap, tap. And hold. Open. Again, I ground a little bit. In theory, I shouldn't have gotten the posterior teeth closer, so I'll just check that real quick. Bite, please. Great. And open. And we'll take a look at it, and he's just touching there and there. And see, when I pulled the articulating paper, I got possibly a little deflection that's possible on the inclined portion, so we'll eliminate that. So if we start looking at it, you can see that his lower incisors will come up against a flat plane still. We're, again, trying to eliminate any ramping that could possibly distalize. Put this back in. And what we'll start doing now, relax and close, relax and close, relax, close. Great, stay right there. We're just rocking the mandible, and I'm getting a feel that he's actually rotating. So I'm going to go at this point where he is. Relax, open, close. Good, stay right there. You know, I'm going to make this flatter so it's photographs easier, so let me do that. From what I can see and what the camera can see are just two different things. And close. Open, close. Stop right there. Okay, do you have a hand mirror? Mouth mirror? I think we're going to have to retract it a little bit. Okay, that's okay. Give us 1 second here. Close. Perfect. So what I did with the pencil mark, we'll get a mouth mirror so we can show it a little bit better, is I marked where the labial edges are and where the midline is, so I can go back and physically look and see if he's rotating back to the same spot. So there's the mark on the teeth. Got it? Okay, great. Just relax, close. Stay right there. That was using one hand method, and let's see if it matches up. Does it? Okay. Now let's try, relax for me. Let's try bimanual manipulation. Relax. Close. Stay right there. I'd say we're same spot. If it's seen. So at this point, if you're comfortable that the patient's deprogramming and you can manipulate him, you can go ahead and take your bites. If you're not convinced he's deprogrammed, meaning he's biting, leave the patient in the deprogrammer. Have him bite on and off on it until for at least 5 minutes and try again, because sometimes just that will cause the muscles to relax a little bit. Okay, so all the bite consists of is open for me, and I'll just, if we use, what is this, megabyte? Okay, open for me. Is you just simply place your bite material on the posterior teeth. I only go up to the cuspids. Most of it's my own cheapness, not to waste material. Relax and close. And again, you notice there's no strain on him. I'm not pushing him. It's, as I said, just romancing the mandible to get it back to this spot. I can verify with my mirror and my pencil mark that I'm in the same spot. So I feel confident that I've taken him back to the same centric relation spot. I have a question. Does anyone in there want to come in and try manipulating him and see if they get the same spot? You have a few seconds to decide. Good. And open. Nope, no one wants to take me up on it. That's how you take his bites. Okay? So again, you can manipulate him any way you see fit, but without having any posterior tooth deflection. It just allows us a lot more latitude and a lot easier to play with him. Steal that back. So when I do that, Mike, does it feel like I'm pushing you at all, or no? Okay. Now, just for the satisfaction of discussion in the scientific, quote unquote, scientific forum, let's talk about the way centric relation was taken in the past. Mike's asymptomatic, I will assume that he has not traumatized his joints, that the ligaments are in fairly good shape. Open for me. So I'm going to take it, relax, push forward, push your jaw forward, back, forward, go back, and close. So I've pushed him back pretty hard right now. And he is at the same spot. Okay? Got it? Okay. That's basically, now even with a narrative, start to finish, what do we spend? 7 minutes? So it's very easy to make a deprogrammer. And it should be that, it'll facilitate taking the bite that much easier. So I'll come back in and see if there's any questions. Anyone want to try and see if they get the same spot? No? You can.
Not yet, Lane.
Okay. Sounds good. Thank you, Mike.
Mm-hmm.